I know it's a long day, but this is going to be really exciting. I'm super excited to hear from these folks about teaching up-to-date and accurate information. And they've got stuff to share with us, and you probably have questions also. So we're going to do that. Let me introduce, we've got some long bios. I'm going to edit those, if that's okay, just to introduce. Probably these folks need no introduction, but just in case, we've got Jill Berkana of the Berkana Institute. She's a board-certified therapist. You probably know that. She's been on the NCB board. She's the founder and director of the Berkana Institute, and she's founded some other schools, too. We'll stop there. So school owner, director, curriculum developer extraordinaire, okay? Doug Nelson, currently the president of the Massage Therapy Foundation, woo! Right? He's the president of a bunch of stuff that you may have heard of, right? Some NMT seminars and other things. Thank you for being here. He's also an author, right? Pete Whitridge, past president of the Alliance. Of course you know that, right? CE provider, educator, and cool guy extraordinaire. Lovely. Ruth Werner, author, educator, artist, quilt maker, and donator to the raffle. And that's really why she's on the panel today, teaching up-to-date and accurate quilting information. Or we don't know where this is going to go. My name's Deanna Sylvester. Thank you for sticking around for the afternoon. We don't know where this is going to go. But I have some questions for the panelists to get started, and we'll just kind of do open-ended questions, and then we'll see where that goes. Does that feel good? Does anybody want to start? Okay. So here are some of the questions that we had as a group that we thought we would discuss, and maybe you have some questions and or answers to these things. But how do we determine what information is current in the first place? How do we know if something's accurate anyways? And why do we, how do we keep an open mind about teaching this stuff, and how do we determine when to integrate it into our curriculum? So how much evidence do we need to say, oh, okay, this is something we need to care about now? So let's start with one of those little aspects first of all. But how do we determine if something is current and accurate, and how do we deal with conflicting data? Because I see things out there that say the opposite things all the time. Does anybody ever look at research and then see the exact opposite? Anybody? Just me? Right. So how do we know if something's accurate? Let's say it's current. Let's say we're reading something that happened last month. How do we know it's accurate, and how do we deal with that conflicting data? Does anybody want to tackle it first? We'll just go down the list.
I'll take on a little bit of that. Can you hear me out there?
Yes.
Okay. So I think the first thing is it's really important that we start to make sure that our entry-level students have at least a basic competency in research and understanding, just basic terminology and methodology and how to read research, and just in the very beginning. Because I know when I went to massage school, and for the massage schools that I've been running for many, many years, we didn't have any of that. And we just now started to add that in. And so I think as educators, we need to make sure that we're integrating at least something that helps the students dig their teeth into research, and also teach them that they have an ethical responsibility to be involved in some way with research.
So I'd like to respond to that in a couple of different ways, especially with the idea of conflicting thoughts through research, which I think all of you nodded your head. I think if we step back, one of the things that I've noticed when people stop me in the hallway, if I'm somewhere, they talk about so glad you're involved in the research because we just need to prove such and such, right? It's hard to know, like, thank you so much. And, that's not really the job of research, is to absolutely prove anything. It's about the process of discovery. It's about asking deep and penetrating questions about that which we love and love so much. And when you see it that way, you don't get so lost in this says this, therefore that must be true. Does that resonate with all of you? And it's really important that we see research in that way as just an inquiry, just curiosity, a formalized approach to curiosity, rather than, edicts. And I think that's one of the things that I also hear, complaints about research. People will say things like, well, I just don't want someone telling me this is how you are supposed to practice, or you do 4 of these, 3 of these, 2 of those, then turn around and, and research is almost never like that. What it does is give you options. It's like a color palette from which you get to choose. Other professions are a model for this. Medicine is kind of based on research, right? But we still call it the art of practicing medicine. So deepening the science only embellishes the art. It does not take it away. That's one point. The second one I'm going to borrow from a friend of mine who's in the National Academy of Medicine. This is his analogy, but I just love it. It's true in his field. I think it's certainly true in ours. In many ways, research or these ideas that we all hold are like little kids playing soccer. Ever watch little kids playing soccer? The ball squirts one way and 22 kids run after the ball, right? And then the ball squirts that way and everybody runs this way, Well, yeah, what's that? Bumbleball, yeah, right. Well, when you watch the World Cup, that's not what happens. The ball goes that way, and everybody has a job. Everybody, they're not distracted by the fact that the ball's over there because they are staying in their lane. They know what to do. Think about that in our own profession. My wife hates it when I say this. She said, people will just think you're old. But, it's my 42nd year of practice, Think of all the different things that have come and gone over that time, Can you think of a few? Like, structure's the answer to every question. Get the structure right, it'll all be good, right? Structure is irrelevant. Trigger points are the answer to all pain known to man and creating peace in the Middle East. There's no such thing, nobody's dealing with muscles. Now it's like there's no such thing as a muscle, there's only fascia, stay tuned, right? All these things, we just keep going through these cycles because we're all chasing the little ball around the soccer field. I think what we need to do is stay grounded also in fundamental practice and not get too tossed about by the waves of, in a way, fashion. I think we need a little bit of an anchoring thing, and researchers are very good about this. It's why they also are not thrilled when the press, interviews them, because what they're saying is they have some evidence that, and then the headline is, new solution to cancer just came out, and they're horrified. So I think we need to approach it from that way as well. I think stay grounded in practice. And last point, also from neuroscience. So this person told me a really interesting story. Do you know what an fMRI is? It's this blood flow in the brain. When that first came out, the people who were enamored with this new technology said to the neuroscience community, everything you have been teaching is wrong, right? And there's this new science, and everything you've been doing for, it's like totally off and if you don't follow us, you're total fuddy-duddies and, you're stuck in the, all that kind of stuff. Well, where this came out? 10 years later, 15 years later, it's oops, sorry about that. Turns out it's a new technology. We didn't really understand it fully, and so we misinterpreted some of the data. So I know that everybody hates that research lurches forward a millimeter at a time. It's actually a really good thing, that it is much more grounded and not tossed about by the winds of change so easily. So, boy, that was probably a long answer. I think I'm just going to quit now. Okay. Ruth.
right?
That was an excellent answer. I have only a tiny bit to add to that. As a teacher and as a writer, I have come to deeply value the power of a declarative sentence. Massage therapy has this kind of impact on circulation. And when I began to learn that a lot of those declarative sentences might not be true, it was very, very upsetting. However, it is also really exciting. We can say, oh God, the foundation has completely shifted under my feet, or we can say, oh my gosh, so many new opportunities and possibilities have just opened up in front of us. And I think if we have that as a starter attitude and we model that attitude as teachers, while we have fewer declarative sentences, we also have the ability to say, here's what we understand now, and watch this space. And it's your job to watch how we learn more. And this can help us avoid the bumble ball, the chasing after the shiny science. I get really frustrated when I see people arguing about how their science is shinier than other people's science. It's not my favorite part of what happens among some thought leaders in our profession. I mean, really what it comes to is the idea of modeling comfort with not knowing all the things. And the other thing I would add, and which was something that Jill brought up about teaching basic research competency, and it's been already hawked several times this today, but I want to really encourage you to pick up this Instructor's Guide to Teaching Research, which is at the Foundation's table. And there's stuff in here, and it's also available electronically. You can build handouts from this for your students. I taught a tiny bit of this just this week to a group of students in New Zealand, and they were like, oh, where were you 6 months ago when my assignment was to write a lit review? I love the idea of instilling this concept that we have an idea of what we understand now, but that may continue to grow and evolve and change. And that's how we model that.
I love that.
Just add one thing for me, the intersection of science and art is a sense of wonder about the world. And I think that's what Ruth is alluding to. If we all have that, oh my gosh, there's a world we don't completely understand. That's a sense of wonder about the world. So it's cool.
Okay.
I'm adding now. Hey! Okay, so I just want to add that I think humility is paramount to model that constantly to our students, that we don't know, we don't understand, I don't have that answer for you. If we do that, then we're able to model that it's okay for them not to know either, and to have this sense of wonder and always be able to lean on this idea that we don't know and we're trying to find out and we're working together to find out the answers. And the answers that we find out now may change. And if we can be that, have the courage to have humility in front of them when we're teaching them and say, I don't know, then it allows them to be more relaxed about not knowing themselves.
It's a much stronger statement to say, I don't know the answer to your really interesting question. Let's work together to figure this out, is a much stronger point of view than making something up.
So what I'm hearing, this is really exciting. So as an instructor, what I'm hearing is I don't need to be necessarily afraid that there's conflicting information out there. It's about the attitude you have towards it. So it reminds me, I studied molecular biology in school, so I'm kind of a nerd. But so I remember one thing from this, and it was one of my professors said, I think it was a general biology class. I can't remember if it was genetics or something, but he said, what I'm about to teach you, half of it is wrong, but since I don't know which half is the correct stuff or which half is the wrong stuff, I'm going to tell all of it to you, and then, so it kind of set a tone for us not to be afraid to learn information, and to understand that research is about discovery. It's not about finding the right information. So I'm curious that our panel is called Teaching Up-to-Date and Accurate Information, right? And we teach accurate information as we know it right now, right? So thank you for kind of setting that tone as it's kind of an attitude rather than I need to know all the information before I share anything with my students. I need to know the right information before I share anything with my students. That's a really good point, you guys.
So I would say we need to stop looking for answers and start thinking about better questions.
Ooh, good one. Speaking of questions, let's ask some more. Let's see what else we can get out of these folks. So we've got all this research stuff coming out, right? And let's say we do study the booklet from the Massage Therapy Foundation, or we take some foundational classes on how to teach research, how to understand whether it's good or bad research. Let's say maybe we start there. Many of us aren't even there, right? But let's say we start there and we kind of understand how to look at research and tell whether it's... So how do we know when there's enough evidence to make changes in curriculum, for example? So if I'm teaching a particular class or set of classes and some new information comes along, how do I know when there's enough information to go, you know what, it's time to change this? How do we tell that? I think, Ruth, you and I were talking about this earlier.
I'd like to speak to that. I remember way back when I was in massage school, Dee Dee remembers that.
You remember that?
When tendinitis was considered to be an inflammatory condition. And I mean, there have been some, and when, we couldn't work with people who had cancer, and think about the evolutions that you have seen in your lifespan in this profession, and what led those evolutions way back in ancient history was a plurality of research that turned out to be reliable over a period of time. There's not a good answer, I don't think, to your question, when do we change a paradigm? I think we need to, part of the job of being, I will say, part of my job in being a textbook writer who has the blessed ability, thank you publishers, thank you Books of Discovery, for allowing me to do updates. So part of the job of the people who make textbooks, that's the authors and the publishers, is to take the temperature of when the language is changing about certain situations. And so, where I draw that is from what are the conventional providers, conventional medical providers saying about the pathologies that I write about. If it were an A&P book, I would ask a similar question. What are the people in conventional medicine saying about this? Because we are teaching students to speak a language that will allow them to have conversations with their clients and their healthcare providers. I think if we try to get ahead of that ball, ahead of that hockey puck, we're going to miss it. Our job is to speak the language that allows us to be collegial with our allied providers. That's my short answer to that. That's, when is it time to adopt a paradigm change?
I think that's really good. As a textbook author, you're keeping up with it. So as an educator who uses textbooks, knowing that they're kind of static over time and that they will be updated, but maybe they're not updated as quickly as maybe you're using it. Jill, you and I were talking about this. Do you want to address kind of how you talk about that information with your students?
Sure. So in the very beginning at orientation, we're teaching the students that this is not static, that the education and the whole environment of the profession is evolving at a very accelerated rate right now because of the investment that we're putting into research. And so with that, we need to let them know that this thing is moving very quickly. We're going to do our very best to keep you up to date and current. And we need to make the effort to stay connected as educators to the leaders and all of the people that are facilitating the research on behalf of the profession. We need to stay connected, and we need to be downloading that information and delivering it to our students as quickly as we possibly can. My personal journey as an educator, for the first 7 years as an educator, I didn't connect with my network at all. And I was coming from developing my curriculum around an education that I had received 20 years prior. And it wasn't until I got involved with the network of educators that I started to go have these aha moments, and people that were that knew more about certain things than I did were waking me up to certain realities and certain things that I needed to know to be able to deliver this current information for my students. So now I rely heavily on my advisors. I rely heavily on staying connected, and thank goodness for the internet, so that we can all stay connected. And as soon as I get some information that may describe some kind of phenomenal change in the story we've been telling people for forever, that's when we need to say, hey, the story's changing. We don't know what the end of the story is maybe yet, but this is shifting now, and we need to keep our finger on the pulse of this as it is shifting.
Pete?
I don't teach entry-level education, but as a continuing education provider, let me just add, for me, part of it is the anchor point is clinical practice. I still see over, I think it's about 1,200 people a year in my own practice, just me. My office sees over 300 people a week, in one location. So again, the people who come in, they only know that they hurt. They haven't read anything. They're not being influenced. Either you help them or you don't, And so I think for me, that's also an anchor point, is implementing, getting insights from research that might change my clinical practice, implementing those things, and making sure that the results are tangible and reproducible, because theories are really easy and results turned out to be really hard. It's easy to talk about something, it's harder to actually get stuff done. And the clinic is nothing but humbling, and that's why I will never give that up. So.
Pete,
And I wanted to add in, because I think that one of the pieces that is so important is, as a faculty, right, the challenge for the faculty, if we're thinking about curriculum development, is that everyone is on the same page, and that people are reading similar articles and discussing them. And so part of what I'm always challenging anyone that I'm teaching with is, hey, have you read this article, and let's talk about this a little bit, almost as if we were having a journal club. And this ability for us as teachers to be research literate, to be able to critically look at something and bring that to the classroom, and even before bringing it to the classroom, to bring it to other peers, is really an important aspect of, I think, what we're talking about. And having been a director of education and looked at doing my CompTIA reaccreditations, we always talked about, well, should we keep this in the curriculum, right? Is this an important thing that's going to happen in the clinic? Because so many times we had the story from 40 years of teaching, and we had to look at, do we really want to keep telling the students this? And so I depend on current research from a variety of sources, but I have a subscription to Scientific American. And I bet half of you don't have a subscription to Scientific American. Is that correct?
Anybody?
How about a third of you? How about two of you? Right? So this, right.
We got three.
So what I'm saying to you is, I learned so much physiology here. I'm an anatomy teacher. I get so thrilled to be able to share this kind of thing. So that's what I would add to this discussion.
That's a really good point, and you brought up the fact that you would talk amongst faculty about do we still want to keep this in curriculum? Because when we talk about learning new stuff from research, we're always thinking, what are we going to add to the curriculum? Right? Well, we've got to add that in, and you just keep adding. But it's really important. The culling process is really important too. What do we need to remove that is no longer relevant? Maybe it's sort of correct, but it's no longer relevant. It's really like the activity we just did. There was a whole section for stop. What should we stop doing, right? So that's a really good point. As far as updating curriculum isn't just adding stuff in. Well, there's this.
this whole other world of pain where if you are staying current, and then your graduates go out there and they're working with people that are not current, and there's this conflict happening in the workplace where somebody's going, no, I can massage this person that has cancer without any more training, without any additional training, it's fine. And then there's the forms that say you can't get a massage if it's in the first trimester of the pregnancy. And everyone else on staff is all about, yeah, we can't do that. And your one graduate's going, yes, well, this is wrong. I was taught this was wrong. So I think that while we're starting to and trying to keep our students on the cutting edge, we need to get out there and we need to educate the employers, because it's challenging the current graduates' confidence that perhaps we've given them inaccurate information because they're working with all these people that haven't been updated.
And to your point, Jill, we had talked before about how to, it's important to update your curriculum so that all your new students coming in and stuff, but what about your alumni? And how do you keep in touch with them?
Well, that's a whole nother thing that every school has to decide if they're going to take that on. I've chosen to have a network that is ongoing with ongoing mentorship, and whenever we get information that we need to update, we inform our entire alumni of the changes so that they're kept current.
Does anybody do that? I'm just curious, do you have like your network of alumni when you get some new cutting edge stuff that you think is really important, you send it out? That's terrific. When we were talking, it hadn't occurred to me, but of course that's an important thing to do.
Yeah. So I think that's just such a beautiful point, Jill, because in school you have that captive audience, but in our profession so many people are in their little silos. We have too many islands, and we just need to reinforce the idea that all islands connect underwater. We need to connect them together, and otherwise you just you can get very myopic in your own experience. So it's a great point, really.
Did anybody want to add to that? Okay.
Yeah.
Oh.
I'll just say that just yesterday, I had a student that was having this ethical dilemma at work, and she was maybe going to get fired because she was refusing to do something that we had taught her was contraindicated. With a spa client, and I wasn't positive about my response. I didn't want her to lose her job, and I wasn't positive about my response, and so I reached out to a colleague who has expertise in that field, and I got the answer. And that was a fast-moving moment for this lovely graduate who might be losing this job that she was really lucky to get and really happy to have. But she's trying to do the right thing in that environment. So I'm not sure what to do about that. But hopefully just bringing that problem into the light will create an opportunity for us to start to think about as a profession how we can solve that situation, because I think it's a big one. It's a big problem.
That's a really good point and question, and as Doug discussed, having the islands are connected underwater, you knew someone to reach out to, and doesn't that kind of solidify why we're all here? We have each other to reach out to in situations like that too, because we don't necessarily know. I mean, that's the foundation of ethics. There isn't a right or wrong answer. It wouldn't be an ethical dilemma if there was, right? So, well, did you guys want to add to that? Folks down there? Good. Well, part of the questions that were kind of posed to us were, how do we keep an open mind and teach with nuance? So, and of course I didn't write that question, so I'm curious what they meant by that, but I think what is going on here. And what we're curious as far as the panel goes is you have all of these knowns, or what we think are knowns, and then you have the unknowns. And how do you do that and remain confident and remain open-minded and demonstrate what it is to be not only an educator but a practitioner in front of future practitioners, or even in a continuing education capacity? So did anybody want to tackle that one?
You know, I would say, again, I always kind of go back to the clinician thing. As a clinician, isn't that what happens every day in the clinic? You sit in front of somebody. Are you absolutely confident that you're going to get the result? I am not, you know. But so, you know, and I'm sure you've never had this happen, but, you know, you spend roughly a minute and a half with someone, and then they say, what do you think's going on? Like, give me, 2 minutes to come up with like, really? But it's the, my answer to them is always, well, it could be this, or it could be that, or it could be this, or it could be that. And so if you're asking me right now, the answer is I don't know. But there's two kinds of I don't know. There's a, I don't know, door closed, or there's an, I don't know. That is a door open, right? That's the door open to further discovery and learning. And if it's this, then this will be true, this will be true, this will be true, and this won't be true, and this won't be true, and this won't be true. Or it's this, and this won't be true, and this won't be true, and this will be true, and this won't be true. Or it's this, and this will be true, and this, and, okay, sorry. So what that means is, in a way, I don't know, but I sure know how to find out, right? So it's that process, it's not about the answer, it's about clarity of the process. And I think we deal with that every day. It's how we deal with uncertainty. It's how we deal with life, right? It's no different.
2 graduations ago, I received a box of Depends diapers because of Ruth. Okay, so
Do tell.
Ruth.
The answer to every question about pathology is, it depends.
Okay, so I have the privilege to have Ruth Skype in to our pathology and our research competency class. With every class, she Skypes in, and if anybody out there has an opportunity to have Ruth do that, please do that. Really? I didn't get that one. Did I?
Wait a second. Oh, okay.
But anyway, if you want to be really humbled fast, go ahead and Skype her in and try to stand on your merit of what you told them. Anyway, I learn a lot from her, and this it depends thing has just been such a great, beautiful thing to stand on in terms of the pathology and the research, and we should get a plaque and put it up, and yeah. Mm-hmm.
Thank you. Thank you for the pitch. That's very nice. But this sort of brings us back to a repeating theme that I saw in our exercise earlier today, which is a multitude of stickers by the section that says teach critical thinking. When we teach with critical thinking, which is to say, here's what we understand now, here are some things about this that are in play, this might change. When we teach with that attitude of discovery and humility, we are also modeling some steps in critical thinking. I think we can all afford to get more analytical about what that really looks like and what we ask our students to do. And I want to reflect that also, and part of critical thinking is figuring out what it depends on, what are the variables that need to feed into this decision. But that, leads us back around again to Doug's statement about staying in the clinic and how you can make all the sentences, you can say all the declarative sentences you want, but if it doesn't actually apply to the person who's under your hands, nothing matters. So it's all connected. But I think it needs to start with the attitude of trying to figure out what's reliable and relevant information, and then turning that into a process of making some decisions and evaluating results. It all depends.
Do you take the jumbo pack? Sorry, I'm dealing with elder people, it's okay. I buy them at Sam's, they're 99 or something. So as a person who has a degree in history and who thinks that history is also a guide and a reflection point, I think this is a really also such an important aspect. I brought the history book written by Pat Benjamin. I'm hoping that many of you have this in your school and that you're referring to this and that you're actually teaching this as part of your world, because the students have no context when we're teaching them things that are super new, when they don't even know what a Xander machine is or what the medical gymnastics really were. And when we can connect things back to history and say, well, this is what has been done, and we found that this doesn't quite work the same as we thought, then the students can connect to what we're talking about. And so over and over again, whether you're doing an update or whether you're doing some curriculum development, we have this rich history that students do not know. How many of you know who Margaret Palmer is? Right? Margaret Palmer wrote Lessons in Massage in 1901. Right? It's a beautiful book. I have it up on my Dropbox, and I make the students who show up late to class read a couple chapters from Margaret Palmer. Right?
Cool.
They're like, wow, I didn't even know it's such a great profession. So what I'm saying to all of you is, this whole piece about being adaptive. As a teacher, I have to have adaptability. I have to teach sustainability, and I have to teach the student that I don't know everything, and I'm never going to know everything. So let's keep playing with this. Let's be authentic with each other and just not know.
That's a really good point, too, as far as teaching critical thinking skills, because we think of critical thinking in maybe a finite way, thinking about a particular, but how about thinking about our profession in general? And if I start today, I have no idea the critical thinking it took to get from 1901 to now. Right? Yeah.
From midwifery and nursing, this is a deep book.
Yeah. And we talk a lot about getting integrated into healthcare. Well, what is our history with healthcare? Because we have one, right? It's not starting today. Yeah. That's a really good point. This is fun. Does anybody out there have questions too? So look at what's going on over here. Jody's going to grab one of the mics, and we're going to have a few questions from the field, too.
So I'm curious if you could say something about how communication and presence doesn't change as far as a skill that needs to be taught. And so you talk about curiosity and wonder and how important that is as an instructor. And I think our students leave the classroom, if we happen to be that type of instructor, thinking, isn't that cute? Now I'm going to go out to where shit is real, right? And where the splenius is here, and I'm going to rub that. And so how do we create a classroom environment that actually has our students leaving as wonder-filled practitioners who know what can be known and are really comfortable, like Ruth said, with there's always going to be more that is just plain unknowable, and that's what makes us different from the other people who are in healthcare if we're talking about integration. Like, we're not in competition with the rest of healthcare. And this is the soft skills everybody's talking about, that if you did that would cover 90% of what's not getting done or taught in massage schools now, if you really could ask those questions and really be like, I didn't know that.
Anybody want to start?
Well, let me just respond to one thing about that, Lauren, like your example of the splenius, Boy, I remember the first time I did dissection, not prosection, but dissection, when did they start putting it there? I never got a postcard in the mail with a change of address. Mensa never sent me a postcard either, but wow. And so teaching students that, that picture you see on your phone of that anatomy, that's somebody's picture. That is not your client. And now, using palpation strategies, let's see, where does, have them do something that is the pec minor, and then you see, oh, that first head's like up here. You never see that in any anatomy book. Well, guess what? Pete is not an anatomy book. Pete is Pete, and that's where his attaches. So maybe we should treat where it is instead of where the picture says. And then you begin to see, oh, it's much more fluid and much more plastic. And so I think it's one way to bridge that. Does that help in any way, Lauren, answer that question?
Yes, it does. And I think that part of the wonder that we're missing, and I think I really want to make the point that soft skills, like we have to stop saying that. And we have to get really clear about what we mean when we say soft skills, but that it's not even about this person's body might have a muscle in a different place. It's about this person's experience will be different every time you see them. And when their dad died, it's not going to affect them the way it affected you when your dad died. And that, like, the only way to get there is good, truly curious questioning. And how do we build that in? That it's not questioning to get to an answer. It's questioning to elicit useful information.
Lovely.
I love that because there's a level of questioning where our students may think that they're not confident because they're asking so many questions, but there's a level of questioning with confidence, right? And how do we get them there? I can confidently ask these questions because I have a skill set that helps me move in that direction. At least that's what I got out of what you were kind of hinting at. So,
I would like to address that too, and just say that we have a responsibility as educators to make sure that our education is comprehensive, and that we're teaching communication skills, we're teaching ethics, we're teaching psychology of touch. We're giving them basic fundamentals in these concepts so that they know where, they know a bit about it, they know where our scope ends and where it begins. We need to be able to interact with healthcare teams, mental emotional healthcare teams. We need to be able to work with other healthcare professionals and know how to interact with those people. We need to know how to approach our clients with unconditional positive regard. And we need to know how to listen, actually listen to what the client is saying and get our egos and our agendas out of the way. And have courage to serve these people where they're at, wherever they're at, be it on Tuesday at 4 o'clock or Thursday at 4 o'clock. Their dog just died. Now something else has changed, not project our experience with our dog dying into what we think about them. We have to help our students develop this deep compassion and empathy and ability to communicate from this place of actual caring and truly listening while we're making sure they don't step out of their scope of practice. Mindfulness, being actually present.
So, and Lauren, I think that this is a skill, right? When we talk about skills, and so we model that as teachers, and the fundamentals of each program look to me like some forms of human development and community. And so I really honor your question, and I hope to challenge everyone in the room that, you know, your classroom is a mini community, and there are relationship issues that come up in every classroom. And as a skilled facilitator, we learn to move through together. And so I think that's what's happening in this room as well.
If I could just add one thing from a clinician perspective as well. I'm thinking back about, it's probably 7 or 8 years ago, but I was, asking questions of this young man who came in for treatment. Here's what he said: "Can we just cut the charade?" Like, wow, that's subtle. And he said, "You know what? Everybody has always asked me all these questions, and they do whatever the hell they were going to do anyway. So don't ask questions, so his point was, don't ask the questions unless you're actually going to do something." And I thought, this is awesome. It's not going to go well for you, but because now I'm going to ask you the question, and when you give me your answer, I'm going to tell you what that means to me and what it does or does not mean, So when you say, yes, it hurts if I, but not if I, then I'm going to tell you, here's why. And I did that, which, as you imagine, he loved, right? It was like court-ordered punishment for him. But then on the table, there was about 15 minutes of no talking, and then he started laughing, and I remember thinking, this is funny to you, right? And he said, no, this is like the first time anybody's ever done what I asked them to do. Which, in a way, he meant as a compliment, but how sad is that, right? So don't ask the question unless you're going to change what you do in response to the answer.
That's huge.
Thank you guys so much for doing this panel piece, and I got to say I'm really excited to hear conversation around, one, keeping things current, but then also this concept, de-implementation. How do we stop doing things, whether in the practice or teaching or what have you? And this isn't something that is unique to our field. In fact, this is something that many fields are really interested in. And my question to you guys as education leaders is, with a really clear interest now on de-implementation science, we talk about all the things that we need to start, but how do we leverage the work that's being done in other fields? So not just complementary integrative medicine and health practices, because there's a lot internationally that's working on this, but how do we as a field leverage some of that and also potentially leverage some of the support from funding of this de-implementation science, either from a practice standpoint or an education standpoint? I'm interested in your thoughts on that. Thank you.
Anybody want to?
I have no thoughts on that. It's the first time I've heard of de-implementation science, but I wrote it down so I can go and look it up. What I can tell you, though, and it's fascinating to me because the next edition of the pathology book comes out in this winter, and a huge part of the process I've been going through now is comparing this to previous editions and realizing how much I have left out of previous editions, and that's because points of emphasis change. And things that in my judgment would be relative for people to learn change and evolve over time. I'm just in my little silo, and I'm making those decisions sort of all by myself. I get as much feedback as I can from reviewers and from users, but that's all I got. And so I can't wait to go and look this up and figure out how I can be useful to the profession in this way, at least as a provider of a textbook. But you guys heard of this term before?
No, this is exciting.
Well,
This
so
is great.
I'm lucky enough to do some guest lecturing at the University of Illinois Medical School. And I was just talking with the faculty about this, Nikki, because med students, they're just, oh my gosh, what they get stuffed on them over a period. You can't keep adding more stuff. That's one thing. You have to also take some things out. And what decisions do you make about that? And adding stuff in is easier than taking stuff out, which is that any good writer, right, knows. And by the way, that stuff that's in there that doesn't support the point actually confuses the issue. So I think one thing, Nikki, is, and to your point, there's so much to be learned. Other people are already down this road. We should learn from them. We should embrace those ideas. We don't have to make this stuff up on our own. There are good models to do this. And we are not alone in this. And that's a really wonderful thing. So thank you for bringing that up. That's
Yes,
wonderful. Thank you, Nikki.
And Nikki, I'd add probably a good example of that in our own field is from the American College of Physicians, when they're recommending the use of massage and heat as a supplement or as a replacement for the use of prescription of opioids on many levels. So, what are we doing as massage therapists promoting the knowledge of that we should be using massage and heat when the American Colleges of Physicians are recommending that? So I think that's a good example.
Whitney?
So a question I have is, with a lot of the people who are in this room have a responsibility for preparing their students for licensing exams. And the process of items appearing on a licensing exam involve information gets out in the public, it gets out in research, Then eventually, a couple years later, that research is consolidated into a textbook, and then that textbook is referenced for the items on an exam, which means there's a pretty significant lag time between when new things come out and when they actually get referenced for textbooks upon which the licensing exams are made. So my question is, do you have suggestions or ideas for how educators do both of these things, which is stay current with information and at the same time prepare students for things on the exams which might not be current?
Excellent.
Whitney, did we not have a chat about softball questions? Thanks a lot. Yeah.
Feels a little hardball.
You know, when Deanna was actually in communication with members of this panel and asked us to submit some possible questions, I submitted something similar saying, don't ask me this one because I have no answers. It's tricky. And what I must always fall back on is critical thinking. And, you know, analyzing the variables that are going to feed into choosing one of your 4 options on your licensing exam. It kind of sucks that we're stuck in this cycle, and it will get worse because the renewal process for textbook publishing, and we'll talk more about that tomorrow, you know, is probably not as aggressive as it should be. And I don't have a lot more to add to it than that, except that it's difficult.
Anybody else want to catch the ball?
Yeah, I have to emotionally prepare my students for that test. And I start on day 1 of my program to emotionally prepare them, because if they get emotionally crushed, then their brain stops working and they can't critically problem solve. And there's a lot of questions that are being tested, right? Am I right, educators? There's a handful of questions that are being tested. So those questions may be not qualified to be on that test, but it could derail the students emotionally and their confidence, and then they can't think. So I just wanted to throw that out there.
She threw the ball back. That's right. I think that's what happened, isn't it? Where are we
There's a real resistance to change. I'll give you an example with terminology. It's been since the 1990s that attachment terminology for muscles has been recommended that we do not use origin and insertion. It's been, you know, it's got too many flaws in it, that it would better to use proximal distal. And yet, you know, as an author of a science book, I ended up in that area having to have a sequence of terms because we are unable, and this is broader than massage, but we're unable to let go of a persistent theme. And it gets carried and carried and carried. And so I'm pretty progressive with that. And I was determined to leave that terminology, origin and insertion terminology, out of the textbook. And yet I gave in because it is so embedded in our language structure. So a lot of what we talk about in the idea of moving forward and letting go, and I had a student say to me, I offer every year a continuing education class to alumni and others too, but one said to me, I come here every year to unlearn. And I thought that was brilliant, that adds to that idea of uncluttering, you know, but when we are sometimes oppressed by stuff that just won't go away, it makes it very difficult.
It's true.
Yep. My wife and I have this little joke. You know how many people it takes to change a light bulb? Change?
Can't get past that word.
I just want to ask you a question on how you decide what you're going to prioritize as what you're going to say. Because I'm on Facebook, I'm typing in a group right now. It really gets contentious. People have their opinion, and man, do they almost tear you apart if you have any other opinion than what they have. Now, I can go down a list of things like, does fascia stretch? Does therapeutic stretching help prevent injuries? How long do you apply ice? And there's a lot of information coming in that differs. So my simple thing is, I don't want to confuse students and say, look, here's 15 different things that think. But my question is, how do you prioritize what you're going to use as something you're going to tell your students? Because, again, it gets quite controversial. And I don't think there's an exact answer for everything, but I'm just asking for what your process would be to limit some of the stuff that you would say and add to what you thought was really important.
I think that's a great question, Michael. And one of the things that we always discussed when I was at the Florida School of Massage was how will this apply in the clinic, very much like Doug talks about. And then we talk about the actual physical location of that, you know, whether you're at a franchise or at a spa or at a resort or in your own private clinic. And there's differentiation that can come from that, yes? And so what I always encouraged everyone that I taught with was to describe how they practiced and then give rationale why they practiced that way, because everyone learns a different way. And I think that there's no way for us to overcome someone else's resistance, but I think that we can model openness, adaptability, sustainability, and the ability to actually discern when something is bullshit.
I'd like that ability.
Yeah.
I would like that.
It is impossible to be impartial. We all walk into every situation with our own filter of biases. If we can recognize what our bias is and say, look, here is my bias, this is my paradigm, and this is the point of view from which we're starting this discussion. However, be aware that there are many other points of view about this thing, but here's from my point of view, this is what I would like you to take away today. I think that's completely legitimate. I really like what you just said, and I want to support that, and I had something very witty and it just flew out of my head, so sorry. Oh, can I tell you about my heckler? Okay, I had a heckler. I am very blessed. In many, many years of teaching, I have only ever had one heckler in a CE class. And I was teaching many years ago. I was teaching a class, and the topic at hand was HIV/AIDS. And I had a guy stand up at the time that it was appropriate to ask questions, who did not so much ask a question as, you know, take 5 minutes to share his point of view that HIV doesn't cause AIDS. AIDS is caused by AIDS management drugs. And, you know, it was bizarre, and it was unfortunate. And, you know, I mean, really the only thing I could say to him when he paused to take breath and it was appropriate for me to interrupt him is say, I can see that you take this point of view really seriously. This is not the worldview that I am here to share. And that was all that it, I mean, he left, and he came up to me during a break later and say, I don't blame you, I know you're just a tool of the medical industrial complex. But, I mean, my point is there are people who will have different paradigms. It is not, I don't think it's our job to persuade anybody that their point of view is wrong. I think it's our job to persuade people that our point of view is solid. And then they get to do what they want with that. It's not, but it's not an either-or situation, unless it's the, you know, that HIV doesn't cause AIDS. I'm here to say, I will make a declarative sentence. HIV causes AIDS.
I don't know if that answers your question, Michael, but as far as prioritizing, understanding your own bias is really important, which means we'll all have different priorities as we present, it seems like.
You know, I think in some cases, Michael, you can, like for instance, here's an example. In a book that I did on pain, it's a chapter on phantom pain, and it's a lot about cortical reorganization and that sort of stuff. On the plane here, I read this wonderful research article in the current issue of Pain, that journal, and it was a randomized control study, really beautiful, about how afferent input, you know, was really important in making a difference in phantom limb pain. So the idea that it's really coming from cortical reorganization, you know, centrally down, you know, in their study it was elegantly done, and it's really the other direction. So again, it's like yes and, you know, not yes but, and it's like presenting both sides of the equation. That you can't do that with everything, I understand that, but when possible, just show them the two sides and the rationale for both, and we'll see over time which one will prevail. But again, by prevail, I don't mean the loudest voice. I mean clinical results, because I think we can get lost in this, but it's about whether it makes a difference in the lives of the people who grace our table. That's always the thing that matters.
Thank you, Michael. I completely misunderstood. I thought you were asking, how do you prioritize what you put your emphasis on in the classroom? And what I'm hearing now is how do I choose what studies I want to take most seriously, or how do I choose which studies are going to change my opinion? Is that more accurate? What he said. No, truly, it's about what works, right? And so if there's data that, the data that to me is most compelling is the data that is most applicable in a hands-on setting. And that bears fruit in a hands-on setting. That's my answer to how do I prioritize, or where do I give my credence? Does that help?
Let me just, one other thing, Michael. Actually, not at the med school, but it was a physicians conference, like 150 physicians. We were just talking about the concept of referred phenomena, you know? And how do we know this? We know that if you inject, for instance, if you inject glutamate in the extensor digitorum, most people, 4 out of 5 people will feel it in their middle finger, whatever. So one physician said, well, what's the mechanism of action? You know, and the honest answer is, we don't know, you know? And his face was the, oh, you know, that kind of thing. So luckily, I had the presence of mind to ask him this question, which is, can you tell me the mechanism of action of anesthesia? Because if you can, you're the only person on the planet who can do that, right? And every physician in there knows we don't know. Do we use anesthesia? We do. Are they using it right now across the world? Yes. Why? Because it works and it's reproducible, yet we do not understand the mechanism of action. There's a lot in our field that we don't understand. As Ruth said, that is not a deficit. That's a like, oh my gosh, we're involved in a field with many mysteries. How beautiful is that?
That is a really good point, and you know, that actually deserves some applause, right? Because part of the description of what we were going to discuss today says, keep in mind that even in the medical field, only about 20% of protocols are thoroughly vetted. Yet they're used because why? They're working. We've got to do something, and we sort of know they're working. So we can't stop what we're doing when we know it's working. Robin?
I just wanted to sort of comment to Jill's and Ruth's comments about graduates and in the workplace and how they're trying to, validate what they've learned that is clearly more accurate than those that don't. I had a graduate a couple years ago who had exactly the same problem, and he called me and he said, "Professor Anderson, what do I do?" And I remembered in the research class you showed us that book that we got from the Massage Therapy Foundation about the myths and truths of massage therapy, and I printed it out and I brought it to my workplace and I said, "This is what's accurate, not what you learned. We have to keep, keeping on top of education and keeping on top of research as it continually happens." And I mean, the poor guy almost lost his job over it, but then the business owner realized that those resources were out there and it completely changed the work environment. So I agree with you. You have to empower your graduates to be able to speak the truth and to be able to pass on that information and to change that dynamic because it's so important. So thank you for addressing that. I appreciate it.
Yeah. That is a really good point, too. Do we have another?
Thank you. I have sort of a question of the research end of how to work with it, because ideally with research, doctors, when they're going through their training, it's like when you hear hoofbeats, think horses, not zebras. Because, basically what the research is about is what are the horses? What are the treatments that people are doing? But there are outliers to that. And how that all fits into the aspect as well, because, like for example, a few years ago when they tried to change the mammogram protocols and the furor that caused and so on. So I guess my question for you is, how do you talk about the horses and the zebras and sort of incorporating that into teaching the up-to-date and accurate information?
In that there are outliers and not just the central things, but there could be other factors.
Yeah, because there are times when people come to my practice,
Sure.
and they've tried all what I call the horsey treatments.
Yeah.
The standard allopathic stuff, the standard kinds of things that we're teaching, but the outlying kinds of stuff works with them, like
Yes.
what you were talking about with, well, what's in clinical practice is really kind of what matters. And so by the time people come to me a lot of times in my practice, they've already gone through all those other treatments. And so I just kind of say, well, Einstein's definition of insanity, let's try and do something different here to see what happens. And so how do you reconcile that piece with that?
May I? Two things. As a clinician, for every a new client who presents with something, or any client, I always ask myself two questions. One, what makes me think this is soft tissue, right? Is it in my domain or not? And because it's my expertise, it's my bias, so I have to be doubly conscious about that. And then number two, the question is, and what else would explain this? Like if it becomes really obvious, I think it's this, then at some point during the session, I will take that off the table in a way and say, okay, if that wasn't true, what else would be true? What else could possibly explain this? And that's just, I think, good practice. But I want to share a little story that Larry, who's a friend of mine, is an engineer, and he lives next to an orthopedist. They're good buddies, and they get together and they share some single malt scotch. And the engineer and the orthopedist watch orthopedic training videos. I know, they're weird. But they just sit and orthopedics can be very much like engineering, right? So one time they're just sitting back, they're watching this video, and Larry said to I won't say his name, to the orthopedist, said, I think 98% of what you do, I could do. And the orthopedist took a sip of his scotch, put it down, looked at him and said, yeah, and it's the other 2% that matters. So, we can all do things when everything goes as planned. But again, if you spend time in the clinic, you know things do not go as planned. And it's not a horse, you know? So anyway, thank you. And I guess that comes in the teaching aspect. Absolutely.
Yeah, so as educators, we've got people who are brand new to massage. A lot of us are talking to people who are brand new to massage. How do we address that? I mean, we got to teach them about the horses, but that's part of the learning about critical thinking. It's not just the facts, it's what do we do with this information? And is there a process of discovery that can be attained? Did you want to add to that at all?
Where the critical problem solving comes in.
Mm-hmm.
And in order to do critical problem solving, they have to have a lot of knowledge. So we have to teach them certain amount of knowledge and then test them on it, make sure that they've embodied that knowledge. Then once they have the knowledge and they know the basic rules of engagement, and we've cleared them on that, we know they know the basic rules of engagement within our practice and what we do, then often it's about your gut.
How do we teach that?
Yeah.
Well, I think that you cannot rely on your gut if you're not present. And if you're not willing to really listen to the client and, again, getting ego and agenda out of the way and really looking deeply at the situation. And then referring to your textbooks, referring to your advisors, your mentors. And it's a practice, it's a practice. It's called a practice for a reason. And sometimes the longer we're in practice, the more we get exposed to what we don't know and understand. The longer maybe we're in practice, the more complicated and the harder it becomes to really trust what we know, what we think we know, or what we've learned. So I don't know if that answers your question at all.
Yeah, thank you. A little bit, yeah, just a tiny bit. I need to push back on the gut thing. And what I'm about to say, I believe sometimes, and sometimes maybe not so much. But I believe that intuition is another word for thinking really fast. And forgetting from place A to place C without realizing that you actually went through place B in the middle, but you weren't, you didn't know. And I think that critical thinking has been my byword for today, and I put all of my high value stickers next to the critical thinking lines on the things. But a big part of that speaks to the zebras horses question, which is something that I think a lot of us forget to ask, which is, what am I missing? What assumptions do I not even know that I'm making? What am I leaving out of the possibilities that could be at play here? And I love that negative space, that what's missing piece. And I think, I love how you spoke about this, Doug, but that's really what it comes to within critical thinking, is trying to figure out what's missing.
Yeah, well, here's a little piece of research in that sense. What is the number one source of medical errors? Do you know what it is? Confirmation bias, right? So, because once you think you know what it is, you'll find every reason to support that idea, and that's where I'm going to go back to and what else would explain this thing, So, and so there's an abundance of that kind of stuff out there, and many of those are more case study kinds of things. But my friends who are emergency room physicians now, in fact, this person I know, I just talked to him. This is a startup company that has an algorithm for when you plug in these kinds of symptoms, the horses, all those things will come up. But for an ER doctor, they need to be thinking about, what am I not thinking about? And those ones that are down 8, 9, and 10 on the list, those could kill people, But you don't see them often enough that you don't think about them. So the software actually reminds those physicians, don't forget, that's also possible. So that software is based on, again, the literature. So
These are really important questions, and we actually are running out of time. We have one more question.
We have a closing thought.
A closing thought, and then we'll kind of wrap up. Deborah?
Hi. Just on the terminology point for 1 sec, one of the things that I think we should do is use the term research literacy instead of research. Like, we don't really teach research, but we do teach research literacy, and I think that's associated with consumption and evaluation and considering the merits of what we're reading and so on. And in our school, we have 23 faculty members, and over the past 10 years, we've talked as a group about, what do we do about this trigger point thing? And, we've got all these people like raining negativity on somebody who might, say something positive about Ayurveda, all this kind of stuff that goes on online and so on. And, we started the question as, how do we decide what to teach? How do we decide what to leave in our curriculum and what not? And that's a really relevant question. But we started to turn it into, can we just free up the faculty members who look at questions differently? Like, we have people with different academic backgrounds, people who have different points of view, people who have different sort of places where they find their information. And if we decide, how to do it respectfully, then we can actually, in front of the students, say, well, this is where I'm coming from on this, and I know, someone is coming from this viewpoint, and we debate it sometimes in the faculty room, but there is no actual answer. And then I think what we do is create in our schools an environment that is really more like research literacy, and it allows students to kind of take it as they see it, and people will decide, I kind of like this point of view better, and that's actually real life, right? So I think I would just say, encourage us to try to create that environment in our schools more where it's principled debate. It's really part of what science looks like. And I think that helps us, try to not get into the what's right, what's wrong, what's right this week, that sort of thing.
That was a beautiful summation. Yeah, thank you. That was sort of a beautiful stopping point. I mean, you made just such a good point, and for us educators to really know how do we reconcile that in the real world and model that in the real world. So let's just give a huge round of applause to our panelists for standing out here and having this discussion.